Hello everyone and welcome to Safe and Smart Medicine Use, a practical guide. I am Associate Professor Dr. Izzuddin Fahmi Abu, and in this first module, we'll explore something that affects all of us, understanding what medicines are and how they work. So what exactly are medicines? In simple terms, medicines or drugs are substances that help prevent, treat, or relieve diseases and their symptoms. They work by interacting with our body's natural processes. For example, painkillers like paracetamol work by preventing pain signals from being transmitted to the brain, thus alleviating discomfort. Antibiotics such as amoxicillin kill or stop bacteria from growing. Antihistamines like loratadine help reduce allergic reactions by reducing the body's response to allergens. Each medicine has a specific purpose, and when used correctly, it can make a real difference in improving health and quality of life. Medicines come in many forms: tablets, syrups, creams, or injections, but we can also group them by how we get them. First, prescription medicines. These medications are only available with a doctor's advice. These are usually for conditions that need careful monitoring, like antibiotics or blood pressure tablets. Second, over-the-counter or OTC medicines. These medications are those you can buy without a prescription, such as paracetamol or cough syrups. They're useful for mild symptoms, but you still need to read and follow the instructions carefully. And finally, traditional or herbal medicines. These are products that are derived from plants or natural sources. There are traditional medicines that have been used for generations in many cultures, including ours here in Malaysia. But remember, natural doesn't always mean safe. Herbal remedies can interact with prescription drugs, so always tell your doctor or pharmacist what you're taking. One of the most important skills for smart medicine users is knowing how to read medicine labels. Labels give you essential information about how to use a medicine safely. Always check these 5 things before taking any medicine. Number 1, active ingredient. What makes the medicine work? The active ingredient is the component that makes the medicine effective in treating or preventing a specific condition. Number 2, dosage instructions. How much and how often to take. Follow your doctor's instructions carefully. Do not exceed the recommended dosage. Number 3, indications. Indication tell you what the medicine is used for. In other words, what condition or symptom it helps to treat. Always make sure the medicine you're taking matches the problem you have. Number 4, warnings or side effects. These are important information which tells you what to be careful about when taking your medicine. It also lists possible side effects, things that might happen after taking it. Always read this section so you know when to seek advice or medical help. Number 5, expiry date. Never take expired medicines. Always check the expiry date before consuming any medication to ensure its safety and effectiveness. Even small details like take after meals or store below 30 cc are there for a reason, to make sure the medicine works as intended. So to recap, medicines play an important role in preventing, treating, and managing diseases, helping us live healthier, better quality lives when used safely and correctly. There are 3 main types: prescription, OTC, and traditional medicines. Always take a moment to read the medicine label before using it. It gives you the right instructions, the correct dose, and important safety information, so you can use your medicine safely and effectively. In the next activity, you'll explore an interactive infographic that shows how to read a medicine label. Then share your thoughts in the discussion forum. What's one thing you learned today that surprised you about how medicines work? Remember, being informed is the first step to being safe. I'll see you in the next module, where we'll learn how to use medicines safely and effectively. Thank you for watching.